If you rely on Social Security, SSI, SSDI, or survivor benefits, take a deep breath and stay with me for a moment. The year 2026 is bringing major changes, and while some of them sound like good news on the surface, the reality is far more complicated and, for many people, stressful. Starting January 1st, 2026, nearly 75 million Americans will see changes in their Social Security checks. Yes, there is a 2.8% cost of living adjustment, COLA, but that's only part of the story. Behind the scenes, there are confusing payment schedules, rising Medicare costs, stricter disability reviews, and the quiet end of paper checks. If you don't understand what's happening, you could be caught completely off guard when your January payment arrives. This article breaks everything down clearly, honestly, and in plain language, so you know what to expect and how to protect yourself.
The Social Security Administration has confirmed a 2.8% COLA increase for 2026. This adjustment applies automatically to Social Security retirement beneficiaries, SSI recipients, SSDI recipients, survivor benefit recipients, and spousal benefit recipients. But here's the truth many people won't tell you up front. For millions of seniors, 2.8% is simply not enough. Right now, more than 5 million seniors are already living below the poverty line, and that number is expected to grow in 2026. Groceries, rent, utilities, and especially healthcare costs are rising faster than Social Security benefits. Let's look at what the increase really means in dollars.
SSI, Supplemental Security Income. Individuals, increase from $967 in 2025 to $994 in 2026. Some estimates suggest it may reach $997. Couples, increase from $1,450 to $1,491. Because January 1st is a holiday, SSI recipients will receive their January 2026 payment early on December 31st, 2025. Social Security retirement benefits. Full retirement age. Maximum benefit increases to $4,152 per month. Retiring at age 70, maximum earners, maximum benefit increases to $5,251 per month. Nearly 7.5 million SSI recipients will see their increase at the end of December, while about 71 million Social Security beneficiaries will see changes starting in January. Who is affected by these changes? These updates apply to retired workers already receiving Social Security, SSI recipients, elderly, disabled, or disabled children, SSDI recipients, widows, widowers, and children receiving survivor benefits, spouses receiving benefits based on a partner's work record. However, disability recipients need to be extra careful. The SSA has increased disability reviews, and some people are seeing their status change to not eligible with little warning. If this happens to you, appeal immediately. Waiting could cost you months of income.
2026 Social Security payment schedule, clear and simple. Many people get confused by payment dates every year, so here's an easy breakdown. Social Security payments based on birthday. Born 1st to 10th, paid on the 2nd Wednesday. Born 11th to 20th, paid on the 3rd Wednesday. Born 21st to 31st, paid on the 4th Wednesday. SSI payments, paid on the 1st of each month. If the 1st falls on a weekend or holiday, payment comes the last business day before. Key dates to remember. January 2026. January 14th, birthdays 1st to 10th. January 21st, birthdays 11th to 20th.
January 28th, birthdays 21st to 31st. January 30th, SSI payment for February. February 2026. February 11th, birthdays 1st to 10th. February 18th, birthdays 11th to 20th. February 25th, birthdays 21st to 31st. February 27th, SSI payment for March. Knowing these dates helps you plan your bills and avoid unnecessary stress.
This is the part that frustrates millions of seniors, and rightfully so. Medicare Part B premiums are increasing. The standard premium has already risen from $174.70 to $185, with expectations of further increases in 2026. Because Medicare premiums are automatically deducted from Social Security checks, much of the COLA disappears before you ever see it. For example, a $27 SSI increase may turn into $17 or less. A $41 increase for couples could be cut nearly in half. This is why so many seniors still struggle even after a COLA increase. The COLA formula problem. Why seniors are falling behind. Social Security currently calculates COLA using CPIW, which tracks spending by working adults. But retirees don't spend like workers. Seniors spend more on healthcare, prescriptions, rent, and utilities. There is a better option called CPIE, Consumer Price Index for the Elderly. Experts estimate that switching to CPIE could increase benefits by $300 to $500 per month. That kind of increase wouldn't just help, it would change lives. Important changes you must prepare for. Paper checks are ending. Direct deposit or direct express is becoming mandatory. Disability reviews are increasing. Keep medical records updated. Earnings limits are rising. More flexibility for those still working. What you should do right now. Log into your My Social Security account and confirm your details. Write down your payment dates. Check eligibility for extra help programs, Medicare savings programs, SNAP food assistance, LEHEAP energy assistance. Call 211 for free local help and resources. Speak up about CPIE. Change only happens when people demand it. Let's be honest. 2.8% won't fix everything. If you're struggling now, things may still feel tight in 2026. But remember this, you've earned these benefits. You've paid into the system. You deserve dignity, stability, and respect. More than 75 million Americans are facing the same challenges, and together those voices matter. Staying informed is the first step toward protecting yourself and your future. If you've made it this far, you're already doing the right thing, paying attention, and that matters more than you know.